Hello and welcome to the HealthBridge Podcast. I'm your host, Holly B. I'm so pleased to have you here today for an amazing, mind-blowing discussion, really, with Dr. Kevin Smith. Dr. Kevin Smith is an ear, nose, and throat doctor based in Houston, Texas, whose pioneering work is transforming the lives of migraine sufferers and optimizing sports performance through innovative breathing techniques worldwide. With a mission to help individuals to enhance their athletic performance and reclaim their lives from the grips of debilitating migraines, Dr. Kevin specializes in a revolutionary nasal procedure that offers his patients a brand new lease on life. At the heart of Dr. Smith's practice is a groundbreaking procedure targeting the root cause of migraines, which is a deviated septum. Through meticulous evaluation and treatment, Kevin has achieved an impressive success rate with over 4,000 procedures performed and a remarkable 90% of patients experiencing significant relief. His approach goes beyond symptom management, and he's dedicated to unraveling the intricate connections between migraines and underlying nasal abnormalities. His research and case reports have shed light on the profound impact of nasal surgery, not only on migraines, but also an incredible and potential connection to other neurological conditions like Parkinson's and Asperger's syndrome. Beyond his clinical practice, Dr. Kevin envisions a future where his innovative clinics serve as beacons of hope for migraine sufferers worldwide. And his commitment to excellence, coupled with a deep understanding of the profound toll that migraines take on individuals' lives, drives him to continue pushing the boundaries of medical possibility. Quite an impressive resume there. And I don't suffer from migraine. So this is a really interesting conversation to me because I learned a lot, not just about migraines themselves, but about really what the sufferers of migraines go through. But what's also interesting is that a lot of times he's finding that the symptom relief that goes with this surgery, this special technique that he uses, can have effects even on other conditions. So the potential for his specific procedure to help with symptoms from autoimmune or sleep apnea issues or these neurological conditions. We're talking MS, Parkinson's, like the big ones that we hear about, the potential for helping to relieve those symptoms is also there. And he's really starting to see that come to light in his practice and is starting to focus more on that research. So we get into some really great, really interesting conversations. Who would have ever thought that talking to an ear, nose, and throat doctor could be so fascinating? But I know that you're going to really enjoy Dr. Kevin, and he's got a really great personality and he has so much passion for what he does. And he shares so much valuable information that if it doesn't apply to you specifically, I guarantee you know many people that his information can help. So, with that, I'll zip it and let you enjoy this really interesting and exciting episode. Dr. Kevin Smith, welcome to the HealthBridge Podcast. I'm honored to have you here and dive into your unique specialty.
I'm so honored to be here. Anytime to spread the word about what I do is a chance to cure some people and help people regain their lives. So I think it ties right in with your podcast. So thanks again for having me.
You actually have a unique space where you can use the word cure. You have a very high success rate in ridding people of their chronic migraines.
I do. I use the term interchangeably with eliminate. I eliminate migraines. And then sometimes I just come out and just tell you, look, elimination, same as cure. So yes. And I've cured all type of migraines. I'm an ear, nose, and throat doctor, facial plastic surgeon, and early on in my career would do these sinus surgeries and nasal surgeries on people to help them breathe better. And in their history, they would say they had headaches or migraines. And then I just noticed that a lot of people were getting better. Now, in medical school, you have to understand that I was taught, like everybody is to this day, that migraines originate in the brain. So, as I was fixing these people and eliminating their headaches, I was doubtful about if they were really migraines. And I started calling them migraine like headaches, migraine type headaches, migraine imposters to get the migraine people to come in. Because if you don't say migraine, they won't come, you know. So started getting people coming in, and one thing led to another. And I specifically was on television with a lady with migraines and told people that they could have access to my expertise by sending me in a sinus CT scan. That's how I can diagnose the abnormalities in the nose that are causing the problem. And I started getting hundreds of scans all over the country, from all over the country. And all of the scans had the abnormalities that I've been fixing all those years. And these are all from people who had migraines. I looked at the numbers, and that's when I surmised that, wow, this is incredible. I'm actually eliminating migraines. And again, migraines of all type, from hormonal to ocular to hereditary, hemiplegic, sleep migraines, abdominal migraines. It just, the list goes on and on.
That's amazing.
It is.
Can migraines, some people have them from early age and on, but
Right.
other people might develop them at different times in their lives. Can
Mhm.
you talk about what might trigger the
Certainly.
onset of migraines?
Certainly. One of the number one abnormalities, not the only one, a lot of people think it is a deviated nasal septum. And people, it's a common term, people understand that. When you look at the nose projects from the face, and the first trauma that we all have, assuming we come through the birth canal, is childbirth. Your face gets pressed against your mother's sacrum. Some come out with a bent nose, some come out with a perfect nose, but you don't know what the status of the nose inside is due to that trauma or injury. And then as we grow older, of course, you have the tricycle and bicycle and motorcycles and car accidents and elbows from sports and knees from sports and babies hitting mothers with their heads when they're on the lap. I've heard all of those reasons. But these are the reasons why some people might have migraines early on. They have an early injury, and some may have it later on when they have a later injury, or maybe they had an early injury and the abnormality wasn't significant enough, but as they grew, it grew with them and then started having problems. So that's probably the easiest explanation as to why sometimes children might have them and others might get them later on in life, or they might go away later in life because you grow and now there's no contact between these sensitive structures.
I see. I am curious. I would imagine that as you went into your profession, your nose, throat, plastic surgery, did you have any idea at the time that you were going to become a specialist in migraine therapy?
Never in a million years. And I often will think about how so many things had to work perfectly for me to get to this point. I could have gone into anesthesia, I could have gone into orthopedics, and I never would have made the connection. But I really loved my head and neck anatomy in medical school and applied to ENT. And I loved it because it's very confined, it's very complex, and it suits my personality. I'm sort of a tinkerer and I like little meticulous things and doing sinus surgery, going into one nostril and doing a lot of work and then coming out, after spending an hour in there and taking someone who's been devastated, depressed, disabled, can't work, and an hour later, giving them their life back. It's just, it's amazing still to me.
Yeah, that's an incredible gift to have. And I'm so glad that you followed that calling. You know,
I
that you
know.
listened to it because people
Mhm.
don't. They think their way out of things because of things that are rational, right?
You're exactly right. And I've always said the body is made very logically, and this is a very logical explanation for migraine headaches. I mean, it's when I use the analogy about a COVID test, well, the COVID test hurt until you remove the swab. And so these people have these abnormalities that are behaving like a permanent COVID swab in their nose that will not stop causing pain until I can do my procedure to remove it and correct it. And so what I'm doing is a normalizing procedure, not anything abnormal. I'm not cutting any nerves. I'm not putting in an implant. I'm not doing any of those things. I'm taking an abnormal nose and making it normal. And thus, it will function like a normal nose, and you don't get the headaches anymore and the migraines.
It makes sense speaking to you that the nose would be related to the migraines, so they're obviously in very close proximity.
Exactly. It's under the brain. It's right
Right.
there. And so anything here can radiate pain to all the areas that people talk about: the forehead, the eyes, the temples, the top of the head. Some get ear pain, some get pain at the back of the neck, even. But yeah, it all makes sense.
I had my first sinus infection early this year. I'd never
Okay.
had one before, and
Okay.
I was blown away by the amount of pain.
Exactly. It does. The
Uh,
sinus cavities are meant to be open to air and air filled. And when you obstruct one of those cavities, where you have atmospheric pressure on the outside that can't equilibrate the pressure to the inside. And so when those aren't equal, you have that disparity. And that's what causes the aches and the pains that you get with a sinus infection.
Mhm.
Yeah.
And can you tie in a relation with you're obviously ear, nose, and throat.
Yes.
So you're talking mostly about the nose, but do the ears play into this? Does the throat function play into the migraine conversation?
Not so much the migraine conversation, but it is tied to nasal airway obstruction. I can just go through it for you. When your nose is obstructed with a deviated septum or large turbinates or polyps or whatever, it can lead to a host of symptoms. You can get a runny nose that's chronic. You can get a runny nose when you eat. I had a gentleman on the plane tell me he had gustatory rhinitis. It's related to the nose somehow. You can have postnasal drainage. In your case, you can have a sinus infection because the airflow is not clearing the secretions in the mucus like it should. It's
Mhm.
designed to have laminar airflow. The mucus comes out of the sinuses into the nose, you swallow it. When you don't, it can collect and cause the infection. It can cause the headaches. It can cause migraine. It can cause eustachian tube dysfunction. And the eustachian tube is in the very back of the nose, but it connects to the middle ear. And when there isn't fresh air going in and out, if you fly on an airplane, you pop your ears to get your ears to equilibrate, then you can have problems with dizziness, intermittent hearing loss, or muffled hearing, or water in your ear, sensation of water. Or you might have a ring in the ear, which is intermittent. The key is intermittent. When I hear that, it tells me that the turbinates are getting large and swelling and shrinking, but they're getting to the point where when they swell, it's impairing the ability of the eustachian tube to work properly. And so that's the ear symptoms. And then if you get just chronic drainage from a deviated septum or a nasal airway obstruction, it can certainly cause the throat to be sore. And then you might cough a lot, which then might lead to hoarseness because you got the vocal cords that are swollen because you're always clearing your throat and coughing. And so there's a host of symptoms that go along with the nose. The key is, as an ENT, we have to understand the connection. And then again, I stress my philosophy has always been find the root cause of the problem and fix that, and it'll fix everything else.
I love that you brought up root cause.
Ooh,
Uh,
yes, I'm a big believer in that. I mean, think about it. You go see a doctor, you have a sore throat, they look in there and say, okay, let me give you an antibiotic, even though your throat really doesn't look red and flaming. You're not
right.
going to get better. You're not going to get better. My ears hurt. You look in the ear. I tell residents and students all the time, you look in an ear with somebody with ear pain, it's clear. We have to think of eustachian tube dysfunction and look at the nose. Will a decongestant help? Do you need to get a scan? Do you need to check to see the anatomy of the nose and sinuses? Let's get to the problem. Let's figure it out because it's not normal.
Yeah,
Yeah.
exactly. So I guess let's dive into root cause just even
Let's dive
further.
in. Let's dive
Yeah.
in. I can go
Yeah.
as deep as you want to.
Awesome. Root cause, I work with women with lupus and other, in the autoimmune umbrella.
Yes.
And root cause is so important there because you can't just give, there's plethora of things that could be root cause, right? So you have to do
True.
investigative work, and it's
True.
probably more than just one thing. It's probably multiple things that you have to slowly work through.
Right.
when it comes to, what you do and working through migraines. Somebody comes into you with a migraine. What's that process of going through root cause outside of just the deviated septum, perhaps? Are there other things that you look at in lifestyle and things? Like, how does that conversation go?
By the time they get to me, because I'm a specialist, you're talking about people who have tried everything. They've tried the diets, which you can do. Anti-inflammatory diets certainly going to help the nose not swell as much. And that's why some people can control their migraines or their chronic headaches. And it helps. It's healthier to be anti-inflammatory. It really is. And it helps with conditions like you talked about, lupus and other autoimmune disorders. Always are going to be improved if you can improve the status of your body, your homeostasis, and make it more alkaline and also make it less inflammatory. But by the time they come to me, I go right to what I know is causing it. We have an extensive questionnaire. A patient who's living in Houston can make an appointment and they come in. They fill out the information, of course. We then immediately get a scan. I have a small CT scanner in my office that's designed for ENTs. Very low radiation. It's not one of those where you lie down, you actually sit up like a dental x-ray machine. We do the scan, they get an exam, they get a nasal endoscopy exam, then we review the CAT scan, I identify the abnormalities, I make my surgical plan, and we have them talk to the scheduler and they're ready to go. Then that's all in the first visit. So, I mean, we got it pretty streamlined and I know what I'm looking for. The thing is, since I'm the only one that I know doing this, I know what to look for in a scan that's causing the problem. A lot of times, if I look at a report, it won't mention the things that I see. So there's a lot of stuff out there that the radiologists don't know, other ENTs don't know, or if it's glaring, ENTs won't think that it's causing a migraine. They think you need to go see a neurologist. And the way I got to understand this was just, I'm a surgeon. I like fixing things. I see an abnormality, you're having problems. Let's fix it and see what happens. I'm always been curious and always been, let's fix it and see what happens. And that's how I got to this point after 30 years of practicing medicine and doing surgery. If you're out of town, people can get the questionnaire, they fill it out, they get a scan, or even they can send me I tell them they can either get a sinus scan, which would be ideal, or send me your latest brain scan because everybody's going to have a brain scan because everybody's looking in the brain for the reason of the migraines. It's important to understand only 5% of all brain scans done on migraine patients will find a reason, like a tumor or an aneurysm or a brain abscess or something like that. So you have 95% uh, that are normal. And these are the ones that go through years and years of medicine trials and Botox and implants and things like that. And of course, those things are good if they work. Don't get me wrong. They're good if they work. But for the majority of people that I see, certainly when I do the procedure, I can achieve a 90% success rate in eliminating the migraine totally in patients when I perform my technique. And it has to be my technique. I've developed it over years. It does include a septoplasty and turbinate reduction and some sinus surgeries. I use the codes for that. It's covered by insurance. However, the technique itself is totally different from somebody who might get a septoplasty to help them breathe better or help improve the sinus function. However, my procedure does give you that benefit as well. It's just done in a much more detailed and thorough fashion than you would just a traditional, say, septoplasty and turbinate reduction. It's the Smith technique.
So I can only imagine that people that finally get to you have been through potentially years and years of pain, of doctors, of pills, of things that they do at home, lifestyle stuff that they try,
Oh,
and
yeah.
they must be so desperate by the time they get to you.
And some are excited to see me. Some are just worn out, tired, and just my wife made me come, or my husband made me come. I've been to see everybody. They're just defeated. And the thing I like to do is when I first see a patient, I've already looked at the scan and made my surgical plan. So I'll walk in and engage them. And sometimes, most of the time, I'll go, before I start, let me just tell you this. I looked at your scan. I'm going to be able to help you. Some burst out crying. Some are so relieved. Some are just so happy that they finally have an answer and it's not the same old visit that they've had to other doctors was like, let's try you on this. Let's try you on that. I'm not sure if you're going to, what are your triggers again? And for me, it really doesn't matter what the trigger is. Migraines are named after triggers and their symptoms, but the origin is still the same with me. It's based on something going on in the nose that's triggering the trigeminal nerve and causing this severe pain. And like you said, the stories are just from people. I had one lady I'll never forget who said she threw up so much she had to take a bucket with her in her car, at her desk, in her car back home, by her bedside, because she threw up so much because of the pain. And then you have other people that can't work. They can't do anything with their families. They can't connect with their children. They can't connect with their husbands. They got a divorce because of it. They can't work. Um, they're just isolated. Initially, they get sympathy. But if you've gone to every doctor, think about it. You've gone to, baby, we've gone to every doctor. We've got every scan. They don't see anything. Why are you having this headache every day, baby? They care, but after a while, it's like, come on now. And then they get isolated. And they get doubted by their family members and their doctors even too. I've had people say they went to Mayo Clinic, Cleveland Clinic, got kicked out, said, "We don't have anything to do. Why'd you come back here? There's nothing else for us to do for you, ma'am. You need to go." And then they'll come to me and they get relief. So I'm proud of that.
Really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode. So many people in the autoimmune world can relate to that
Yes.
isolation, that the people just not believing them after a certain point. And
Yeah.
I feel for that community
Yes.
so much, so
Yes.
much.
They're not living life. And
Right.
then they're getting beaten down because they just happen to have a disorder that nobody really understands or has gotten to the bottom of it. That's so sad. Yeah.
So you talked about different types of migraines being
Yes.
called different things.
Yes.
What are the different categories of migraines?
Oh, wow. You have tension headaches. You have cluster headaches, which are known as suicide headaches, caused by the same abnormalities. You have the abdominal migraine. They get abdominal cramps and things like that, similar to IBS. And I never forget a little young girl out of Louisiana who said she was always bloated. She's very thin. She had IBS and pain. She couldn't eat pasta and pizza. And I saw her at her third visit. She goes, "Dr. Smith, I don't have any more migraines. But guess what, Dr. Smith? I can eat whatever I want to, and I'm not bloated all the time." So there's some connection with that. I'm looking into all those things too. But yeah, ocular migraines, you have silent migraines that really don't cause pain, but might give you some visual aura. Then you have these complex and hemiplegic migraines that are just fascinating because they will look like a stroke.
Mm.
And so they go to the ER, they get worked up for a stroke. And about the second or third time, the family's like, no, no, it's not a stroke. They have hemiplegic migraines. We just need to have some pain control or what have you. And I've had some people with those migraines who had symptoms that were included blindness in one eye, weakness or paralysis of their limbs where they couldn't walk, tremors, seizure like activity, slurred speech, word garble, blackouts, sleepwalking they just kind of walk off and not know what they're doing. And all those symptoms go away when I fix the nose and eliminate the migraine. It's just incredible.
It is. It's almost too incredible to believe. And
It
yet
is.
you have the proof.
5,000 people up to this point. The only problem is in America, there's 40 million people with migraine.
Ugh.
And in the world, there's 1 billion people with migraine. And so I'll be working the rest of my days because what I have to do is set up this program I'm working on where I can train surgeons either in the academic settings, just train the group of surgeons that do nasal sinus surgery so that they can help their communities and then lecture and train across the country and then worldwide. Yeah. So I'll be working on this the rest of my days. Yeah.
Yeah. I was already concerned that you're the only one doing this and hoping that you were going to say that you're
Oh,
in
yes.
process of training.
I have to do that. It just takes time when you're working
Of
a
course.
practice and you're trying to do these other things, and it just takes time. So I'm looking for, if anybody's out there, I'm looking for the perfect partner. Melinda Gates, Bill Gates, Mackenzie Scott. Migraines impact women more so than men. So I'm thinking those would be some good folks to start with, to have a conversation with, to see if they might want to have their legacy linked to a wonderful medical discovery.
Mhm. I can't wait to hear what happens with that. As we're continuing this discussion, let's talk
Yes.
about inflammation because inflammation is obviously leads to all kinds of dysfunction in the body. And it's very tied into autoimmune conditions, which many of our listeners have. Autoimmune conditions usually aren't just singular. You usually end up with one, two, three, four. The diagnoses tend to pile on
Mhm.
over the years, and inflammation is a core component of all of those things. I know you've mentioned inflammation in the nose and in the sinuses. Can you talk a little bit more about that and how you can do this surgery, but do you also have to address lifestyle for people moving forward? Are there things they need to change to combat, continuing to add inflammation to their body, for example?
Very good question. As I stated, anti-inflammatory diets are just healthier. They just are. So I'd encourage everybody to do that. The nose is comprised of these dynamic structures called turbinates. They're the air conditioners of the nose. They swell and shrink in response to flu, colds, menstrual cycles, inflammation of any kind, salty meal, MSG. Just all those things can cause the turbinates to really swell. So allergies, so inflammation does that too. So if you're very inflamed, those turbinates can swell. And when they swell, in the case of these headaches and migraines, they can touch structures, either the normal floor of the nose, the lateral wall of the nose. They might touch the septum. A septum that might be straight and might not even have a deviation to it. And it can cause headaches too, headaches and migraines. So that's the main reactor to an inflammation in the nose would be the turbinates and how they swell. I'm sure you get microscopic inflammation of the mucosa in general in all the nose and sinus mucosa, and including the eustachian tube, that can give you problems that we talked about earlier with the ear symptoms and the sinus infections and or sinus headache and the pressure. So yes, it certainly plays a role, and people can help curtail those symptoms by really reducing the inflammation. And as far as what I do, I always encourage that. It goes along with my main focus being to fix the abnormalities and get the structural components of the nose to be normal. Because even people in general who are inflamed and have a normal nose they don't have to really suffer from headaches and migraines. That makes sense. Not everyone does, but certainly we use, in the case of people with allergies, I'll use a nasal steroid spray, which is an anti-inflammatory spray to really focus on the nose and to get that kind of settled down, especially early on after they're healing from their surgery. And if they have allergies, they'll continue to use it later on. A lot of them like using the saline irrigations afterward, which irrigate any allergens from the nose that might be triggering inflammation. So those things help too. I don't go so much into dietary changes and things like that, but yeah, those are some things that I do that are specific to my specialty.
Mhm. Yeah, I think I can see how these things can really go hand in hand together. What I'm also interested in is obviously I take a very holistic approach to helping reduce inflammation and
Yes.
reducing symptoms and flares, right? With
Yes.
chronic fatigue and lupus and all those things. But I think there's also much to be said for the Western approach, as well as I think what's most exciting is just new technology that's coming out and new discoveries like yours
Mhm.
that has really great implications for not only working together with holistic, but just for the future of these really hard, debilitating issues that people are having. We're learning more and more. Are there other exciting things on the horizon that that you're interested in is like within your field that you
Oh
see maybe
my.
coming down the pipeline?
You're a good host, my dear. You're asking
Ah,
some very good questions. And let me first off say that no, what you do is very important. The holistic approach, it goes hand in hand with everything. It's wonderful. If you can take care of something holistically rather than having to take some medications or what have you, then that's the way to go. And if you can control it, not everybody wants surgery. Not everybody wants nasal surgery. You're performing a very important task by delving into and understanding the holistic approach to disease processes. I commend you on that. Let's talk about what I'm looking forward to and what's really fascinating in my realm. The complex migraines and hemiplegic migraine patients got me on this course of reading about what else are migraines related to. And oh my goodness, I opened Pandora's box with that one. Migraines are related to at least 75 other neurological disorders. Let's talk about some of the big ones: epilepsy, cerebral palsy, dementia, Parkinson's, Alzheimer's, Tourette's, autism, Asperger's, irritable bowel, Crohn's disease, retinitis pigmentosa, and the list goes on. MS. I happened to have a woman 2 years ago with MS and migraines comes to my office, had the abnormalities, got her surgery done, and for 2 years has not had a migraine, nor has she has an MS episode that used to come on every 6 weeks where she'd had this foot drop. I've screened 3 Parkinson's patients with my CT scanner just as a preliminary research. They all 3 have the exact same abnormalities as my migraine patients. And I have read that Michael J. Fox, his first symptom in 1996 was a headache with a tremor of his finger. And then I read 2 years ago, he's had 2 septoplasties in his nose to correct a deviated septum. Now that tells, I'm putting the puzzles together now. That's
yeah.
telling me that there's something residual in his nose that is likely contributing to his symptoms, because I have people with Parkinson's like symptoms that go away when I do the procedure. So I have to guess that it may be possible that if he sent me a nasal sinus scan, that I would find something else left there, because it's not normal to have 2 septoplasties. Either you had a horrible septum and something was left behind the first time. Hopefully it got corrected the second time, but it didn't because you're still having problems. So that's how I'm thinking. Until I see it, I'm gonna have to believe that. So with those patients, I have to look into what does nasal or what do nasal abnormalities contribute to these other neurological conditions. They're all associated with them in some form, but nobody understands why. So that goes to me having to get a cohort of patients that have these different conditions, screening them all, set a basis for it, write up my little case reports, and just slowly start to methodically build a case that looks at what's the contribution. Uh, if I had to guess, let's talk about Michael J. Fox. If I had to guess, I can't say that I could reverse his symptoms, but I'm pretty sure I might be able to halt the progression of his disease, because some of that stuff might be imprinted at this point. This has been so long, but I sure would like to get a scan from him and just look at it. That's my goal. That I've reached out to the organization and to his managers and things like that, but they don't get involved with his personal life. So it's so hard to get to those people. Yeah. But yeah, so that's exciting for me. I thought migraines were enough, a billion people with migraines, but now I'll go start looking at the association between migraines and what it contributes to these other neurological disorders. I
It should
mean,
just go to a whole lot bigger.
yes, it did. Because, when I look at my hemiplegic migraine patients, I had one guy who, when he got horrible headaches, would stutter. And now he doesn't. He very, very little. He says about 1%. If you compared it to what he was like before, it's like 1%. He might stutter every now and then, but he stuttered so bad that I think he said that he couldn't get his words out and he would curse. So he called it his own Tourette's. which now made me look at Tourette's. It makes me look at Tourette's, and people would say facial tics. What I believe it does, it might be an irritated focus in the nose that is hitting other nerves when it goes back to the brain and registers that pain. That electricity, and it's electricity, spreads and hits other nerves, and that's where you get these other things. That's why the young girl from Louisiana can now eat pizza now, because the nerve to her intestines now is not irritated and they can function like they're supposed to. The body is made up of nerves. Every cell is controlled by a nerve. So if you have an irritated focus, it might be that that's throwing the body off. It's throwing whatever it is. You might get GI problems, somebody else get visual problems. Another person gets foot drop or paralysis of their legs or seizure-like activity. It's just very interesting. Yeah, so it's a lot I have to do. That's why, again, I need a Melinda Gates or a Mackenzie Scott so that we can put all this in place, get it all done, and let it ride.
Everybody listening, you heard it here. If you have any
Please,
connections at all, send them his way.
please do.
I Does TMJ register in with any of this?
TMJ is actually a problem with the joint. It's a synovial joint like the knee, and you can injure that joint with any type of trauma. And when it gets injured or overused, you can get pain where you might get bone on bone or something like that, or the jaw may lock. So it's a structural problem. However, I have seen nasal abnormalities give people ear pain that might be considered or confused with TMJ. They get pain in and around the ear, and the joint is right in front of the ear. So there may be some tie in with that. I have another one since you brought that up. I called one of my professors because it dawned on me, wow, these hemiplegic migraine patients get worked up for strokes when they go in. Of course, my little brain is going, so how many people who are told they got a scan of their brain, it looked like they had a stroke, but the brain scan was normal, and they get a pat on the back and say, oh, you must have had a mini stroke or a TIA, a transient ischemic attack. I asked him, I said, there's got to be a lot of people that have had that diagnosis that likely have a hemiplegic migraine. And what they need to do is get a sinus scan and send it to me, and I need to look at it. Because it's a big difference between filling out your insurance history and going, I've had a stroke in the past or a TIA versus I had a hemiplegic migraine that Dr. Smith took care of and it doesn't bother anymore. So you see how
Yeah.
it all ties in, and it's just really incredible. But we'll get to the bottom of it. You just have to stay curious, inquisitive, and it'll come, and stay excited about it. And it'll
Yeah.
come. It'll be resolved. We'll figure it out.
I love that you brought up curiosity. That's been a big theme for me. I think
Yes.
throughout my health experience over the last 20 years, but especially since I've gotten into coaching and working with other people, is you have to keep a sense of curiosity about your own health. And that alone is such a big mindset shift if you can come at these issues with curiosity rather than fear,
Skepticism.
skepticism.
Skepticism. Just be curious.
Yeah.
Investigate, see what happens, come back. Yeah.
It opens the door to possibilities rather than keeping the door shut.
There you go. I love it. You're
Yeah.
exactly right. Yeah.
Gosh, we need to keep spreading the word. So I
Well, thanks to
definitely
you,
want
we
to,
are.
yeah. And I want to invite all of our listeners to share this podcast with anyone, everyone they know that either has connections for the doctor here or somebody
Right.
that that has migraines or issues
Yes.
that he might be able to help.
And even if they have had, very important point, even if they've already had sinus surgery and already have had a septoplasty or already had turbinate reduction, you still need to send me the scan because I know what I'm looking for. And there could be something else. I've seen people like that before. They're like, I've already had this. I said, come in and get a scan. And we offer scans complimentary at my office. I just want to help people. So I won't even charge them. I'm like, I'll have a husband in while his wife is having a procedure. And I'm like, oh, you have what? You have sleep apnea? You have, oh, why don't you go get a scan? They get a scan. Nose is worse than the wife. And so we sign them up as a patient. I'm out here. I'm a vessel to help patients live the very best life they can live. So Again, thank you for asking your listening audience to spread this to everyone they know, those who might have contacts with partners like the Gates or Scott, let them know. And if there's some doctors out there, if there's some neurologists out there, I've been reaching out to some. If there's some neurologists that would like to work with me and win a Nobel Prize, it'd be easy to do. I'm willing to split it. If there's someone out there that wants to feed me some of those patients we talked about, and let's work together and have some research and win a Nobel Prize and enjoy going to Sweden, let's just do that. Life
I
is meant
want to
to be
send you.
lived.
I
Let's
want to send
do
you to
it.
Sweden. Yeah,
Let's do it. Yes. Yeah, I'm willing to do that.
that's
Yep.
awesome. You mentioned CPAP
Yes.
machines. Can you talk
Oh,
about that? Because we haven't touched
okay.
on that yet, and I know that's a really big issue for a lot of people.
It is a big issue. And again, okay, it's right around the time we just had the debate. And I have to say this because I've been trying to reach out to the White House because when I saw President Biden and the few excerpts I saw, I didn't see the whole debate. The few excerpts I saw, I said, wow, this is all related to his sleep apnea. He got diagnosed in 2008. He was placed on a mask a few years ago. I used to see the imprint of the mask on his face, but I don't see it anymore. You combine that with the fact that he traveled overseas a couple times. He went to Camp David to practice and get ready for the debate. But all in all, he even said, I almost fell asleep during the debate. Bingo. That told me that's sleep apnea.
Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that once applied will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So, if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my HealthBridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode.
Because you or I, who are sleep deprived for weeks or even months, would have had the same exact behavior in a 90-minute debate. And until you fix that and investigate that, you never know about the cognition because the cognition certainly is going to be affected by it. Why? Let's look at what sleep apnea is. You're going to sleep, you have obstruction of the nose or obstruction of your back of your throat. And when that happens, you're holding your breath for more than 10 seconds, several times a night. You're not getting deep sleep. You're not getting into REM. You're waking up tired. That's day one. The next day it repeats. Now you're even more tired from the second night. And you go weeks. You're that much more tired and fatigued, and you can't think, and you're slurring your speech. You have the word garble. And think about this. Let's look at the connection. President Biden also stutters. Remember I told you about the patient that stutters and now he doesn't? Very little stuttering after I did my procedure.
Yeah.
It's all connected. So the CPAP should never be placed on a sleep apnea patient's nose until you know if the nose is normal. So what I
I
do in
bet
my
that
practice,
doesn't happen. I bet that
it
doesn't
does
happen
not
often.
happen. No, it hadn't happened. Look at looking at the president. He doesn't have the body habits of an overweight person that you would typically think might have sleep apnea, which then tells me again to look even more closely at the nose and the throat. There's some anatomical problem going on. He shouldn't, based on the way he looks, have an obstruction causing him to have sleep apnea. So he needs, like everybody else does, a CT scan of the sinuses. I need to review it. The nose needs to be fixed if abnormal, which I'm sure it is. And then the throat needs to be examined. And oftentimes, I used to take out tonsils and trim the palate and trim the uvula. Now, because I do some of my cases in the office, I can't do tonsils in the office. So what I do is I clip the uvula, which oftentimes is long and thick. I fix the nose, clip the uvula. I've had people who have been on CPAP for 20 years, 15 years, 10 years, get off their CPAP. They don't need it anymore. They're sleeping through the night and they feel much more energetic. Their cognition is improved. They're doing things that they never did before. They can exercise now, which gets the weight off. Then they feel even better. That's just how it goes. And so I'm, again, a big believer. We in ENT have to convince the primary care doctors and other people in ENT that we have to critically look at the nose and the throat in people who are symptomatic and have sleep apnea and snoring. Because when you're snoring, you're sucking on the uvula, it stretches, it's going to get worse over time. You're putting a mask on somebody's nose, and if you fix their nose, if they needed a mask, which is highly unlikely, at that point, at least the pressure can be low so they feel comfortable wearing it. What happens is people become non-compliant, like I suspect the president might be, because when they put it on, the pressure is so high to get over that obstruction, they feel like they're suffocating. It's uncomfortable. They can't sleep. So they figure, why should I wear this thing? I can't sleep with it on. So they don't use it. Now you're back at square one. It's just a vicious circle, but it's easily remedied.
Yeah, yeah.
Easily remedied.
have- I have a whole new understanding and respect for ear, nose, throat specialists.
Yay. Yeah, it's connected to everything, isn't it? We've talked
Yeah.
about nasal airway obstruction, sinusitis, snoring, sleep apnea, headaches, migraines,
And
ear,
another
ear
thing,
symptoms.
yeah, and it's making me think of people with brain fog. Brain
Ooh,
fog is really common with autoimmune,
well, is
and
it?
it's some, oh gosh, and I've
Well,
certainly,
let's get a few sinus scans and just look at it.
yeah,
Let's just get 10 of them and let's just
yeah,
look at them and see what they have. Yeah,
yeah,
brain fog. Yeah, yeah. If they're not sleeping well, so then you might want to ask, how do you sleep at night? Do you snore? Do you have sleep apnea? Does your spouse have to nudge you because they're worried about you quitting breathing? Do you wake up refreshed in the morning? Do you feel good? Do you dream at night? Do you, if so, how many times do you wake up at night? And why do you wake up? I can't go back to sleep. My nose feels clogged. I can't breathe. Some people tell me they have to sit up for a couple of hours and then go back to sleep because the turbinates swell when they lie flat. Think about it. When you lie flat, you're in a more dependent position. So the turbinates are going to swell. The nose is clogged and they can't breathe.
yeah.
That must be horrible. That's horrible. I hate hearing that because I sleep very well at night. I love going to bed. I love my sleep. I put on my meditation music and a couple deep breaths through my nose, which is very important because the nose creates nitric oxide. Now we're going to get into some more details you have to
Let's
understand.
do it.
The nose and sinuses create nitric oxide. So when you inhale deeply through your nose, you're taking that nitric oxide, it's going into your lungs, it's dilating the lungs, it's getting into the bloodstream, it's dilating the blood vessels, which is improving the blood flow to the brain and to the muscles. All the metabolites that are collected in the brain over the past 16 hours that you were awake, they get cleared and flushed so we can start over fresh the next day. And so that's my routine. That's my
Yeah.
routine. I don't have time to meditate during the day. So what I do, I put on my meditation music at night before I go to bed, close my eyes, cross my hands across my chest, and just take some good deep breaths through my nose. And before I know it, I am out like a light.
Love it. Love
And I
it.
love it. And then I get up the next day and I do my surgeries. I help more people to do the same thing. It's fantastic.
That's awesome. I think we've given people a lot to think about and
Good.
re-examine and be curious about now.
Yes,
Um,
absolutely.
is
All
there
because of you. It is true though. No, you asked me to be on here and all because of you. We're spreading the word, we're helping people, giving people things to think about. All of this stuff can be explained. I had a patient in my office just today. She has been 3 months, which is a little longer for most people to heal from my procedure and really start feeling better. She came to my office the first day, angry, hostile to my staff, frustrated. Why? She'd been to several doctors. She was getting the runaround. She had went a CAT scan of her brain. She had some dizziness, and she's an aerialist. She twirls, and she couldn't do it. So she's going to these doctors about this and that and the other. And we sent her through the office, got the scan, came back in. I told her, I said, "Look, I'll be able to help you." And she just looked at me like, "How do you know that's it?" I was like, "It's what I do every day." To me, it's pretty straightforward. See your nose, see the septum, see the turbinates. That's affecting your eustachian tubes, affecting your hearing, it's affecting your breathing, it's affecting that's how it works. She takes a deep breath and just disgusted, whatever. So everybody else is wrong except you. I said, I don't know everybody. Right now, this is what I know. So we slowly she slowly starts opening up. The last visit, we sat and talked. She's showing me pictures on her phone where she performances and all these costumes that she had made for Halloween, where she won first place. She makes these elaborate costumes. And I'm thinking to myself, she's doing better. She never would have taken this kind of time when she first came in. Never. Today she comes in dressed to the nines, just really looking beautiful and smiling. And I got a twinkle in her eye. And she goes, I actually feel much better, Dr. Smith. My headaches are gone. The dizziness is much more minimized. It's 1% now. The muffled hearing I had is pretty much 1% now. I said, it took you a little longer to heal than most, but you're on the right track. I'm really happy. And so now we're going to do a video for my social media in about 4 to 6 weeks with her mom because she was just in a bad place. And a lot of people are in a bad place. They don't know where to turn. They don't know what to do. Nobody can give them the answers. Nobody's making sense. I just had a lady the other day too, brought her daughter in. They had been to several doctors, went to an ENT. The ENT said, I don't do surgery, but what I see on the scan needs to have surgery. I'm going to send you to Dr. X. So they go to Dr. X, looks at it and go, no, I don't do surgery for this. So now they're like, wait a minute. What, what do you mean? So they come to me, I do the surgery, I see what's wrong. The little girl she's 15 years old, is doing fabulously. She's done great. And so they referred like 3 other people to my office with kids who have problems with congestion, and I say it just goes on and on. Again, you're doing a great work here. I appreciate you having me on. I love what I do, as you can tell. And if anybody has any questions, they're welcome to call my office. Can I get my phone number?
Yeah, please.
713-795-0600. And my Facebook page has dozens of video testimonials of all these patients who couldn't breathe, who have chronic headaches, who have chronic migraines, who are now living their best life. And my website is kevinsmithmd.com.
I'm
What else?
so
You were going to ask another
I
question, I think.
I was gonna say, is there any last thoughts
Oh,
or any last things that you want to leave with our
okay.
listeners?
The body is made very logically. When you have any of those symptoms I mentioned in the head and neck area, it can all be explained by a congested or obstructed nose. Unfortunately, you'll have to get a scan and send it to me. I know what I'm looking for. And if you have chronic headaches and migraines, it has to be done with my technique, the Smith migraine technique, because it's been developed over a couple decades now and it achieves 90% success. I have had people go to see somebody else and then they say, oh, it didn't work. So maybe my migraines are actually hereditary. It's just going to have to live with it the rest of my life. No, that's not true. That's not true unless you fall into my 10% category, and I'm still working on them. There are things that I do now that I didn't do 3 years ago. So I'm steady working at it. I want 100%. And my thing would be is to not give up hope. There is an answer for all of you out there. Keep striving to find that answer. If I can help you get to the answer, I will. If you can help them get to their answer, I know you will. But yeah, so I hope they've all learned a lot today and some light bulbs have gone off. And yeah, it's just I don't take for granted about what I do. I've been very fortunate to have all these things line up where I could end up eliminating migraine headaches. It's just fascinating to me, and I cherish it every day. I love what I do. I could do it every day, all day and night. And so to talk about it is just wonderful. So thanks for having me.
Of course. And I know we could continue talking for hours on end
Yep.
about all of this stuff, but we'll have to leave it here. I do want to encourage everyone again to reach out to you. I had a previous coach of mine who talked about assembling her EMTs or her excellence management team. And I think
Mm,
you are such a great add on
let's do
to
it.
anybody's excellence management team.
Let's do it. Yeah. Yeah. I just do what I do. It's my expertise and I love it. And I'm just so happy I found my passion and my purpose in life. That's really what it is. It boils down to that. I'm just doing what I love to do. And there's nothing like giving people their life back. It's nothing like it because I live a good life. I've had a very fortunate, good life. I really have. And I enjoy it immensely. And it hurts me to my core. It really does. I've cried with patients. It hurts me to my core to hear that people don't live their very best life
Mhm.
because we're not here very long.
Right.
So you want to live your very best life. Yeah.
Oh, well, on that note, just thank you for having such a big heart and passion.
You're very
And
welcome.
I look forward to saying everything that you do from here on out.
Well, have me on in a couple years and I'll update you on where we are with things.
It's a deal,
Oh,
definitely.
great. Thank you so much.
Thank you. Okay, be honest. Did that episode blow your mind just a little bit? Because I know it did mine. I really had no idea how important sinus health is. It's not like I dismissed it. It just never really occurred to me to think about it all that much unless I have some sinus congestion, right? That's when you think about your sinus cavity, your ear, nose, throat, that whole combination there. You don't, you're not ever really taught to tie that into chronic migraines. You're not really ever taught to think about the implications that a deviated septum might have in relationship to how you sleep, how you experience life on a daily basis. So I'd love to know what the most fascinating thing that you learned in this episode was. Please make sure to message me and Dr. Kevin to let us know or leave a comment below. I just feel like this gives so much hope to people who have none, who have thought that they've exhausted all of their possibilities for health and healing. Being from the autoimmune world, I know what that feels like. And I talk to people every day that have essentially lost hope. Like they're still looking, but they also are trepidatious to believe anything because they've been let down so many times before and they're still symptomatic. And I can only imagine that chronic migraine sufferers must feel the same way. It's such a debilitating chronic issue to have. So, the fact that we can shed some light on this for you, I asked in the episode for you to please share this episode with anybody who you know that suffers from migraines or suffers from any of the other things that we talked about within the episode. Share this with them. Give them some hope. Tell them to keep looking, keep trying, stay curious, as we talked about in the episode. And please reach out to Dr. Kevin. Interestingly enough, I had just recently received a referral to see an ear, nose, throat doctor, and I shared this with Dr. Kevin after recording, and he says, "Well, you make sure you get that sinus scan and you send it to me now." So I'll be keeping you all posted as that happens. And getting to the root cause of things is, again, something that I talk about a lot on my platform and on my podcast. And I just want to invite you to, again, not only reach out to Dr. Kevin, but also reach out to me as well. If you are in the autoimmune spectrum, if you have lupus, if you are going through all the blood work, going through all the things with your doctors. Maybe you don't have a diagnosis yet, but you want to know what else you can do to be active in your healing process and to be active in supporting your body the best you can while you are experiencing these symptoms or flares. Reach out to me. It would be my honor to help you. And I know what it feels like to be in this space for a long time. And I have dialed in the health fundamentals to help support your body in the midst of having an autoimmune condition. We need to be able to support it from the ground up to address some of those underlying root cause issues that can be maybe triggered it in the first place or are exacerbating things. So please reach out to me if you are ready to jump in and do the work that it takes to love yourself to health. Thank you so much for listening in, for sharing this episode, and for reaching out for a free health strategy call with me. And I look forward to having you listen in again on our next episode of the HealthBridge podcast.